There could be light at the end of the tunnel for people living with HIV and AIDS in Africa. A professor from Wits University has received a 46 million rand grant for research that focuses on reducing deaths from bacterial and fungal infections in people living with the disease. Professor Nelesh Govender joins us now live to shed more light about this potentially life-saving research. A very good afternoon to you, Prof. Thanks very much for your time. Very welcome news, especially coming as it does on the back of a lot of amazing work or progress that we have made as a country, in particular in the fight against HIV through, of course, antiretroviral treatment.
I completely agree with you. This is really welcome news. I mean, I'm delighted that we've secured this research funding. It's really close to my heart. I worked as an HIV doctor about 25 years ago at Chris Hani Baragwanath Hospital in an HIV clinic where we didn't have access to antiretroviral treatment to manage our patients. And about more than 2 decades later, we're in much the same position. What I really mean is, although we've got access to antiretroviral treatment, about 1 in 10 people living with HIV still have advanced HIV disease or AIDS, about 2 million people across the African continent. So it's an enormous problem. People with advanced HIV disease have weak immune systems. We measure this using a CD4 count, and so, these people have CD4 counts which are incredibly low. So the research aims to really understand why people with AIDS become critically ill, why they need hospital admission. We're trying to understand the causes for this.
Are you able to tell us, Prof, or is it what is going to be the subject of the research? In other words, why the 1 in 10 people who die, is it because of these bacterial and fungal infections, or is that what this research is meant to find?
So we're trying to understand why people with AIDS develop, like I said to you, if you've got AIDS, you've got a really high risk of being admitted to hospital with a serious illness. And the major causes of these serious illnesses are bacterial and fungal infections. We know that of the hundreds of thousands of deaths which are related to AIDS each year, about 1/3 to 1/2 of these deaths are caused by bacterial infections or fungal infections. But we don't know exactly which infections these are, how common they are relative to TB, for instance. And we're also not that good at diagnosing these infections because some standard methods that we use in the laboratory miss cases of infection. There are also some really important questions around, is it reasonable to start people who are admitted to hospital with advanced HIV disease on immediate antibiotics to cover some of these infections and save their lives? We also need to measure the risk of death, of course, once people are admitted to hospital.
Yes. And has anything like this been attempted before elsewhere in the world?
So I think we've really got a unique opportunity in South Africa. We've got the largest population living with HIV in South Africa. A large proportion of people with HIV are on antiretroviral treatment, but too many people either stop their antiretroviral treatment or, just leave healthcare for some reason, usually for social reasons. And so they then, develop infections when their immune system weakens. So this is really a unique opportunity to understand what happens in the South African setting. We're trying to understand what's happening across the country. So we're using data from the National Health Laboratory Service, which is really a treasure trove of information, and it'll give us an understanding of what's happening across the country. But then we're also going to dive in a bit deeper at 2 hospitals in Johannesburg, at Helen Joseph Hospital and also Chris Hani Baragwanath Hospital, and follow patients in hospital to understand the causes of these hospital admissions, including bacterial and fungal infections.
Prof, thanks very much for talking to us, and best of luck with the work you are about to undergo.